So I would like to introduce to you is Sister Dr. Luciana ILUGBEHA, AGBA. She's a handmaid of the Holy Child Jesus, HHCJ. She's from Agenebode, Awuchi Diocese, Nigeria. She is on mission to Kalimoni, Archdiocese of Nairobi, Kenya. And she is a medical doctor in Kalimoni Mission Hospital, Juja, Kenya. So, sister, you have the floor. So, moderator, you can
start. Thank you very much, Prof. Thank you for that introduction. Good afternoon to us all.
Good afternoon. Good afternoon.
Yeah. Today we have the privilege to have Dr. MARYAM JAMILA Ali with us today, who is going to give us this presentation with the topic, Building Mentally Healthy Communities Through Multi-Sector Collaboration. Dr. MARYAM is a clinician, scientist, obstetrician and gynecologist, associate professor in the Department of Obstetrics and Gynecology at the University of Jos. She obtained a MBBS from Ahmadu Bello University, Zaria, and completed a specialist training at Jos University Teaching Hospital, Nigeria, earning the fellowship of West African College of Surgeons, FWACS, and fellowship of the Medical College of Obstetrician and Gynecology, MFCO. Dr. Ali further received global health research training at Northwest University, Feinberg School of Medicine, and the University of Arizona, where she was a Global Health Scholars Fellow, a Global Health Scholar Fellow. Her research focuses on cervical cancer prevention, that is my heart, HPV epidemiology, and HIV-associated malignancies among adolescents and women living with HIV/AIDS in Nigeria. She has contributed to several national Institutes of Health-funded research programs and has authored over 25 peer-reviewed publications. That's great. Dr. Ali is also actively involved in mentoring postgraduate trainees and provides faith-based medical leadership through the Islamic Medical Association of Nigeria. Wow. What a big portfolio she has there. So today we are going to have this big topic before us. And Dr. MARYAM, you're welcome to start the topic with us. And I hope we all contribute positively after this. Thank you.
Good afternoon, all.
Good afternoon.
So thank you very much. So today I'll be anchoring this discussion on building mentally healthy communities through multi-sector collaboration. And then I added this because I am a gynecologist and I'm passionate about cervical cancer. So I'm going to give this presentation with a case study. And the case study is on cervical cancer prevention and the strategic role of religious leaders. So what is a mentally healthy community? When we talk about health, we should know that health is not just about the body. The mental health and physical health of everyone is deeply interlinked. So a mentally healthy community is the one where people have hope. They have hope, meaning they have no fear about their health. They also have support, meaning they don't have any stigma or shame. Whatever it is they have, they know they have that support. People will support them. And then they have access to information. It's very important because a mentally healthy community should have access to information, because whatever it is, if you don't know about something, you can't act on it. So having information is very, very important. Then a mentally healthy community should also have some resilience. They should be able to face health challenges together. Not that because somebody has something, then he'll be abandoned and left alone. It's a community, people should support each other. So why do we say a multi-sector collaboration? Why are we emphasizing on this multi-sector collaboration? It's because in everything, not even cervical cancer, in whatever you are doing, there is no single sector that can solve any problem alone, let alone cervical cancer. So together, each sector brings that unique strength so that we all work to tackle a particular problem. So in particular, for cervical cancer, we need the health sector. The health sector provides vaccines, screening, and treatment. We also need the media. The media will provide awareness and correct information. We wrote correct information because you all know about media. Media can actually misinform a lot of people, but we need them to give that correct information. We also need our religious sector because our religious people are trustworthy people. They have values and they have access to the whole community. They have access to the family. And then the community have to ultimately own the program. Because if they don't take ownership and give support, whatever it is you bring to the community will not work. And then ultimately the government. The government is the one that will provide all the policy and the funding. And then together, all we can make a stronger impact. So what is the burden of cervical cancer in Nigeria? We should know that cervical cancer is the second most common cancer in Nigeria, the first being breast cancer. And then about 12,000 new cases are being diagnosed every year. And out of these 12,000, 8,000 women will die. And this death, more than 94%. In fact, we just wrote 90%, but the recent data is showing more than about 94% of this death will occur in low and middle income countries. And then the main issue about it is that 90% of this cervical cancer is actually preventable. It's preventable using vaccine and then screening. So this is not just a health problem. It's a family problem, it's a community problem, and all of us have to collaborate to solve the issue. So what is this cervix? I've been talking about cervical cancer. I'm sure a few people will even be wondering, what am I even talking about? So let's know what a cervix is. So a cervix, if we look at this picture, this first one, this is like a female. This is the female internal organs. This is a picture of a woman with the female internal organs. And by the time we zoom it out, bring out these internal organs, you can see this is the womb of a woman. And then what is the cervix? I was trying to show you what a cervix is. The cervix is the mouth of the womb. This is the mouth of the womb. For us, most of us, if we go to the hospital, for people that have infection, if you are going to have a test for infection, you know, you put some instrument there and try to look into your vagina. That's the cervix we are trying to look for. And then most of the time, if a woman goes to the hospital and she's in labor, what the midwife or doctor checks is the cervix. By the time we put our finger, what we are trying to feel is the cervix. And then we'll say, okay, it's 2 centimeters, that's about 10 centimeters, that's what we're talking about. And that is what we are saying cervix, second to only breast cancer. You can see the other picture is showing the fallopian tube. This is the tube, this is the egg of the woman, both left and right. So just trying to tell you what the cervix is so that you understand what I'm saying. So this is a picture of a normal cervix. This first one. I hope my pointer is working. Are you seeing my pointer? Can you see it? This is a normal cervix, this first one. Yes, so this is a normal cervix. So see how smooth it is looking, smooth and glistening. So just imagine, this is it. When there's cervical cancer or there's any infection, as you move from this first picture to the second one, you can see there's something like an ulcer here. And here, by the time we do colposcopy and we apply some things like acetic acid, this whitish thing is showing. So what causes this cervical cancer? What causes this cervical cancer is a virus we call human papilloma virus. It's a virus. It infects the cervix of a woman. And then before it gets or becomes cancer, it will take almost like 15 to 20 years. And that's why we are emphasizing, because that long time it gives, 10 to 15 years before it becomes a cancer, meaning we have ample of opportunity to screen and prevent it ultimately from becoming a cancer. So in between these points, we can do cervical cancer screening, and then if we pick an abnormality, we have treatment for those pre-cancer lesions before they become cancer. And that's why we are emphasizing on it. And why are we also emphasizing on the cervix? Because the cervix is the only organ within the woman that is accessible. You see all these other organs, the womb, the fallopian tube, the ovary, they are all inside the abdomen. You cannot see them because they are inside. For us to see them, we have to cut the woman during operation before we can see them. So, they are not easily accessible. But for the cervix, you see, you can go through the vagina here. Once you put that speculum, you open it, you will see the cervix and it's very clear. So what are the things that causes this cervical cancer? We've mentioned that it's human papilloma virus, is the virus, but it's not everybody that will have the cancer. If you look at this, from normal cervix to the infection, most of the time, the person infected will clear the virus within 6 months to 2 years. But there are things that will make the virus to persist. And mind you, this human papilloma virus is a very common infection. 80% of us here are infected with the virus. So the only thing is that almost 90% will clear the virus. And it's only 10% that will have persistent infection. And it's this 10% that we are looking for. Because if it is persisting, meaning it can lead to cancer. So there are things that make the virus to persist, like early age at first sexual intercourse, if somebody has multiple sexual partners, if the person smokes, if the person has delivered so many children, if the person has a husband with multiple sexual partners, if the person has immunosuppression like HIV and other immunosuppressants, maybe on renal transplant or even diabetes, because they all have immunosuppression, then the virus can persist. Yes. So on this first picture, this is a beautiful picture of a normal cervix. This is the cervix. You can see it's shining from this cervix. We can say this woman most likely has never delivered because the way the cervix is looking at. But if you move this and this, they are not looking like the first one because these are frank cancers. So you can't even identify and say this is a normal cervix because the virus has eaten up the whole cervix. But at this point in time, the woman will be having a lot of vaginal discharge. She will be having bleeding when she meets with her husband. She will be having sometimes bleeding in between periods. And then can you see these lower pictures? So this first one is what we call warts. In fact, it's a type of human papilloma virus that is not even supposed to cause cancer. This is not cancer, but it's also caused by human papilloma virus. And this is warts. So this is florid vulvovaginal warts. This is another one. This is another florid warts. But sometimes with histology, it can even be an early form of cancer. If you look at this next picture, this is the mouth. You can see the teeth by the side. So like the person is opening the mouth. So this is oropharyngeal cancer, cancer of almost the throat. So most of the time for people having oral sex and other things, they have this. And then this last picture is a picture of the penis. It's also the human papilloma virus that has called penile cancer. So it has eaten up the whole of the penis. So let's go back to our mental health. So what is the mental health link that we are all discussing about? So we should understand from all this explanation and from all these pictures that cervical cancer carries a heavy psychological burden, and prevention brings peace of mind. So that is our own mental health link. We are trying to link it up. Because once somebody is diagnosed with cancer, that fear of diagnosis of cancer is like somebody has been given a death sentence. Then a lot of stigma. You can see from what I've mentioned that causes persistence of the virus. I kept mentioning early sex, multiple sexual partners, partners with multiple sexual partners. So a lot of people, especially the media, when they try to frame or portray it, people will think, okay, it's because you are promiscuous. So that's why, so it comes with a lot of stigma. And then people are anxious. Most people present in the hospital, they present late because we didn't screen, we didn't go for any screening. So by the time the women are coming, at that point in time, it's either they are bleeding after sex, or they are having abnormal bleeding, or they are having foul-smelling vaginal discharge. And once we check, it would have been late. So the treatment, we can't offer surgery. The only thing we can offer is palliation. And the palliation is we can give chemotherapy or radiotherapy. And you know, it costs a lot of money. then ultimately it leads to grief, because families will lose a lot of their loved ones. People will lose their mothers, their wives, and their daughters. So that's part of the mental health link. So why are we discussing this? I was very happy to be given this opportunity to discuss, especially having this platform that has the religious leaders, because currently I'm doing one work with religious leaders. So why religious leaders are strategic for this particular program, and we are emphasizing because religious leaders are our trusted people. They have that moral authority. People listen to them because they are always there, either Sundays, Mondays, and in between, they are always there with the community, and people listen to them. So they have that reach. They have access to men, women, youth, and the elderly every week. And they have influence on behavior, because by the time they talk to you, they can normalize health seeking. So I was talking about the WHO, World Health Organization strategy, which the WHO sat down around 2018 to declare cervical cancer as a very important thing that should be eliminated. And then by 2020, it came 90, 70, 90. And what does this mean? It means that 90% of girls should be vaccinated with the HPV vaccine before the age of 15. So what's the role of our religious leaders? Their role is to announce, to debunk myths, because there are a lot of myths about these vaccines. And then people think that by the time you vaccinate the girl, meaning she is free to have sex. That's not the meaning. The meaning is that you are trying to get the girls to be vaccinated before they even have their first sex. And then the next 70 is that 70% of women should be screened, that by the age of 35 and 45. Here also, we have a role of encouraging our women to come and have the screening. We can even provide a safe space for them to screen. We can organize outreaches where we can call on health providers to come and screen them within the facility. And then the last 90 is that 90% of the women screened should have treatment. Because once you do the screening, that's not the end. The aim is to pick those changes or they become cancer. So if you leave them, they will eventually become cancer. So once you screen, the aim is that at least 90% of those screened should have treatment so that it cannot progress to cancer. So what's our role now? I think what we can do here in Nigeria is we can form partnership, and having this presentation, we are very privileged. We are very happy to announce this and then give this information because it's the beginning of this collaboration. So we can partner with the National Primary Healthcare Development Agencies. These are the people in charge of the vaccines. If you will look now, all the primary healthcare centers have the vaccines, but people are not going there to assess it. Then we have the World Health Organization. That's the coordinating body. They support the program and then give all the support. We need the state government. We have the religious organizations, both the Christian and Muslim religious organizations. They need to sit down together and encourage their people to assess these services since we now have them. So, meaning we need to train our imams and pastors to be our health champions. Because for this new work I was trying to tell you I was doing, I'm working on leveraging our religious leaders to increase the uptake of HPV vaccines. So I had a pilot study where I interviewed some pastors and some imams to tell them, okay, what is cervical cancer? What is HPV vaccines? What do you tell your people? Do you really preach to your people during the congregation or not? And then a lot of them have never even heard of cervical, or they've never heard of the HPV vaccines. So that's where the interview ended because they couldn't answer the remaining questions. They said, okay, if we don't know, how do you expect me to tell them something I don't know? If you don't come to tell us, this is it, and then we understand all the things, ask you questions, and then we are clear, then we can't tell our people. So what we are planning to do now is to train them, to train imams, pastors, so that they are our health champions, so that even people ask them, they know everything about it. So they can use that opportunity during sermons, either on Friday or Sundays, to pass these messages. Then screening outreaches can be performed intermittently in churches and mosques, and then they can have a facility. We can tell them where to refer the women to access these services. And then by the time they understand all the myths about it, because there are a lot of myths about, especially the HPV vaccines. They say it increase promiscuity. Some people will say it will cause infertility, and most of these things are just myths. So if the religious leaders don't understand or don't know the answers, of course, they can't tell their people, because by the time they're asking them questions, they won't know what next to tell them. So what are we trying to do? We want our religious leaders to help us break these barriers, all these barriers of stigma, myths about the vaccine, late presentation, and then they should also encourage male involvement. That is what we want, and we are asking them to do. So the mental health dividend and call to action is that when communities prevent cervical cancer together, all of us will have less fear, we have less shame, more hope, and stronger families. Mothers can stay healthy to raise their children, and by that we'll have a mentally healthy community. Health is a shared responsibility. Government have to come there and fund it. The health workers have to partner with faith and other organizations, NGOs, and other people. The religious leaders have to lead and spread the message, and the community have to act and own the program. Because by the time you are putting all this together and you bring it to the community and they are not accepting it, meaning you can't do anything. So together we can build a mentally healthy communities to be free of cervical cancer. I just brought this. This is one of my posters for the work I told you I'm about to start. So I take this presentation as the starting point, because actually I'm supposed to mobilize religious leaders to talk to them, have the training, and then to see whether we are increasing uptake. So the work we have identified is that even though now HPV vaccine was introduced in Nigeria in 2023. It has been there since 2006 all over the world, but in Nigeria it came 2023. We still have low uptake because, and then I told you from my pilot study, religious leaders told us they have clear and that confidence building information. So what our approach is that we want to train them and then sit down together, because some of the words we mentioned, they may decide to tell us that no, doctor, that's not how to say it. People will not agree. Maybe this is the better word to say it. So by the time we sit down together, we can form that, co-create those messages that they think can be used as Simon guides and posters, and then we can send reminders. And then our expected impact is that we will expect an increase knowledge, confidence from the religious leaders. We expect an increase in parental acceptance, and then the vaccination rate will increase. So our target population we've mentioned is pastors and imam, and for this we want to start, we'll do it in Jos University Teaching Hospital. So thank you very much for this opportunity. That's my last slide. Thank you.
Thank you so much, Dr. Ali. We are grateful. What a nice presentation. And a different approach. I like your approach to this. Different approach, mental health, and you've brought out a condition specifically for us to handle concerning mental health and collaboration. Thank you so much. We are grateful, Dr. Ali, for this presentation. And let me just sum up what she has enlightened us with. And for the fact that I love her approach to this building collaboration regarding mental health. So it can be any other health. It mustn't be cervical cancer, but our passion for cervical cancer has made her to showcase cervical cancer at this time to let us know that such things are happening. And it is true. Thank God that in the 20th century, cervical cancer is now preventable. In the 19th century, cervical cancer was the second most cancer that affects women. The first being breast cancer and the second being cervical cancer. But nowadays, we don't hear it because of these preventive measures, because more people are being enlightened, and we've come to know that cervical cancer is preventable. And the world is really going for that. And we don't have so many women dying of cervical cancer, the much as they die of breast cancer, lung cancer, and colorectal cancer. So Dr. Ali has enlightened us, and she has told us what is cervical cancer, And she has tackled it very well, very well. I hope we have a lot of questions for her, because some of you do call me and ask me, sister, what is this thing about HPV vaccines? The myth about HPV vaccines and all that. So I hope we are ready to ask her all the questions that we have. So what she has actually told us that we need collaboration when it comes to mental health. And mental health affects everyone. It starts from the family, it's the community, the public. And I like the fact that she said the media also has a role to play. The community, the public, you and I, the media, the faith-based community, that is whatever religion you belong in, we all have a role to play. The government have a role. The health sector, health provider, health sector has a role to play. And this role to play, even education, the education sector also has a role to play, because we are talking about children taking the HPV vaccine from 9 to 14 years. They also have that power to convince parents that this is not harmful, this is good for the child. We also have all the NGOs, all other the non-governmental organizations also, they have a role to play. And this role we have to play, she has told us that it is a shared vision. It is a shared vision. We need resources to pool here and there together to make this come true for us. We need capacity building, more awareness, public awareness. We need campaigns. You see our poster, lovely poster. We need campaigns through poster, our WhatsApp, our media platform, social media platform, all that. We need them to be able to talk about mental health and collaboration. We also need data sharing. I saw our first slide. What she gave us there. Data sharing. We need data sharing. We need facts. Fact, not just talking. We need facts. What are we getting from what we are doing? What percentages are we dealing with? And what percentage can survive with what we're doing? What percentage we die, whether we do or not? We need all those. And also, as we say, we need faith-based. Most importantly, this NIREC, we're not talking about NIREC, faith-based, our leaders, the followers. We have a big role to play, because whatever medical or science comes with, everybody believes, this is science. Yes, it is science, but science goes with faith nowadays. Very few don't believe that, but mostly science has come to know that faith plays a big role when it comes to clinicals and when it comes to medical. So that is why our religious leaders must participate in mental health and collaboration. And most specifically, she has come to showcase our own passion, which is cervical cancer. Most especially cervical cancer. Some of us will be saying, why this? And even now, we say she has put out all the predisposing factors, what can lead to. Those are the main things that can lead to. But even nowadays, multiparous women, nulliparous women who don't have sexual intercourse are now having this HPV infection. There was a study that was done in Ghana about 3 years ago, where 100 nulliparous women were taken. That is women who are not married, who have not given birth, no sexual intercourse, put together, and they were able to find 1% of them have this HPV infection. So you see, the way human beings change, that is how diseases emerge. Diseases also change. Diseases have the ability to change, especially virus, rapid changing in viruses. So Dr. Ali has alerted us to that we really need collaboration in all this. It is not the person who is mentally ill or mentally unstable that is affected. We are all affected. Remember, this person comes from a family to a community, from a community to a faith-based center. Maybe you are a Christian or a Muslim, a Hindu, or a Sikh. Other religion, that person belongs somewhere, belongs to the community. So we all have a role to play in order to make this person stable, or in order to bring awareness of these mental health issues, so that we don't all think that mental is about madness. No, somebody who has, even apart from cancer, even acute diseases can make you have great mental health disturbance. Chronic diseases like hypertension, diabetes can also make you have great mental health disturbances. So she has emphasized collaboration is the main thing. Collaboration is the main thing. Let us don't fight alone. You have a relative, let that relative don't fight alone. You have a sister, a brother, a friend, let that brother, friend, sister not fight alone. Let us talk about it. Let us make people who can help us, who can help this person get well. And there are so many these days. Mental health specialists are many. There are many. So let us don't be shy to approach these people for awareness. Thank you so much, Dr. Ali. Now from here, we have our questions ready. Thank you very much, Doc. Thank you. Yes.
Let me start.
Yes.
When I saw that it was a doctor who was going to talk to us, I also look for another doctor to listen to her, because it's only you who can understand. A doctor can understand doctor very well. Moderator, that was a very good analysis. I want to start by thanking our presenter, Dr. MARYAM. When you started, I was just wondering, come on, what has this to do with mental health? And I just discovered that before we started this webinar, I called Sister Dr. Kate. I said, come, it's like I put my hand where the radiation of the computer is coming out from, and the thing is peppering me. I say, how long? He said, it'd be like, say, don't reach 1 week. And it was giving me a lot of concern. So I have to go and Google the effect of computer radiation on human body. When I saw that, in fact, since I got it today, the peppering sensation has come down now. So now what I just got to discover is that when somebody is diagnosed of cervical cancer, for example, I think that one can lead to serious or acute mental health. Like Sister Luciana has said, mental health is not a death sentence. So my question to Dr. MARYAM, you see, in NIREC, I think NIREC is also guilty, I must say, because sometimes we have been having some agencies coming to NIREC to say they want to go to the north for vaccination. But from the report we have been getting, that some of these vaccines are part of international conspiracy. And some, like some foreign funders want to reduce the population of Africa. And that some vaccine, when they give you, the women, they will not be fertile again. And it also has to do with this genetically modified seeds. So, Dr. MARYAM, how can you help us in NIREC to be able to sensitize people that this vaccine for cervical cancer is not actually a death sentence? How do we prove it to the people that these vaccines are really necessary to prevent this cancer in question?
Yes, thank you very much, sir. Should I answer now? I don't know, the moderator, does she want me to answer now?
Yes, you can answer, Doc. Can answer.
Okay, so thank you very much, sir, for the questions and contribution. So what I've said is actually right, because a lot of us have a lot of concerns, and the concern is because we don't have the correct information. As I've mentioned, this vaccine has been there since 2006. Since 2006 to now is more than 20 years, or is it up to 30 years now? That was the first time it was launched. So all the other countries, they have a lot of data. So we have a lot of data. I think it's one of the vaccines that has a lot of data on follow-up, to see what happens. And then the children that have received the vaccine now are already grown up. They have children. They are not, all the other things people are afraid of have been debunked. So there are a lot of studies. This is like a 1 hour, 2 hour presentation that we can't give the full training. In fact, that's why my new work, I said, we are going to train the religious leaders that eventually we are recruiting, because we have to sit down together to say, okay, this is what causes the vaccine, this is how it actually does, or then we will talk, this is what causes the cancer. Then after that, we'll talk about the vaccine, we'll show studies and all the effects. And then even in Nigeria now, people have been given the vaccine even prior to that 2023. That 2023 is just that it was introduced into our national program on immunizations. But even prior to that, some people have received it either privately, it's just that now it's free. So we have a lot of data to show the people that have received it, what effects it has on them. And then people can even show you their family members to say, okay, this is my daughter that has received it. And then I'm still with her. We are not seeing all the things people are saying. And if by chance you have time, I don't know when you come to Jos, I'm inviting you to come to our clinic in Jos University Teaching Hospital. If you enter our wards and you see the woman with advanced cervical cancer, then it will even become more clear that this thing has to be prevented. Because if it is something that can be prevented, then we should not be having it at advanced stages. We should prevent it. We should pick it at the point where we can manage it. If it is something you can't do, then it's different. But for something that you can act on, then really you have to do something about it. So I don't know. This is this is a short time for us to discuss the full cervical cancer and the vaccination and everything. But as I told you, this.
Okay.
Let me also add
what I chose was to leverage on religious leaders to work on this. So I'm going to invite them.
Yes.
Dr. Luciana, please, let me just ask this question. Maybe you can combine all of them. You see, you just talked about cervical cancer. Is there a vaccine that can prevent prostate cancer?
Not yet.
Not yet. So what I'm discussing here, the case I'm putting is on cervical cancer because it has the vaccines and people are not taking it. For prostate cancer, of course, it has all the screening too. People can go and check the PSA values. They can go for the examination to check whether they have enlarged prostate. Biopsy can be taken to confirm whether it's the benign type or the cancer type. So it has some screening too, but presently there is no vaccine for that.
Okay.
Man does suffer.
Thank you, Dr. Ali. No, man no suffer. Man just need to be more careful. Now, let me add to what Dr. Ali has said. Dr. Ali, thank you so much for that explanation. The issue we have on this part of the world is the moral value of giving a 9-year-old HPV vaccine. You know, and some people say, oh, it's to do with infertility. They want to make our children sterile so that they don't give birth. You know, African, we are many, things like that. So this vaccine is very safe. Very, I find so many people even calling me from Nigeria, my friends, other parts of the world calling me and say, how safe is this vaccine? This vaccine is very safe. And why are we targeting 9 to 14 years old? You know, because that is like in our country here in Kenya, in fact, it is free for those group of people. From 9 to 14 years, it is free. You walk into any hospital, you will be given private at whatever level 1 to level 6, you will get the vaccine free if you want HPV vaccine. In fact, it is part of our mother and child immunization schedule, HPV, here in Kenya, because we don't joke with health. Why are we targeting 9 to 14? These are the sexually active ages from 9 to 14. Some people may not, some individual may not agree with me, but that is what research has found out. And since the African adage that says that since men hunters have learned to shoot without missing, birds also have learned to fly without perching. So it is like seeing, you know, what will the future bring if we leave this our children? Because cervical cancer is not going to be detected when you have 1 or 2 occasions of sexual activity. No, it's a future thing. Like Doc said, you can stay with this papillomavirus for 10, 20, even 30 years. Then you see when you are 50, 60, you'll be diagnosed of cervical cancer. You'll be wondering where is it coming from. So that is where it's so we will say, what is the moral value of giving 9 to 14 years. Yes, there is a lot of moral value, which I said, we cannot be discussing those things now. It's like a whole day seminar or a workshop for us to understand that. So the vaccine is very safe. It doesn't cause sterility. It will not prevent you from giving birth to children in future. It will prevent you from dying before the age God has assigned you to die. That is what this vaccine is doing. So please, my sisters, you, all of us who are here, I can see we are very many here. Let us be ambassador of this now. From here, those of us who are here who have heard this story today, that the HPV vaccine, it is not harmful. It is safe. Very, very safe. Thank you. Another question?
Eugenia is there. Sister Eugenia SND.
Eugenia Abu.
Not Eugenia Abu, Sister Eugenia SND.
Thank you, sister. Thank you so much, doctor, for all this explanation. But I think that one of the problems we have is that they don't, first of all, educate people about this vaccine. One of the sisters now, they came to the school, they said they want to inject or vaccine pupils from 9 to 14, as you said. She refused. Those people that came from Ministry of Health, all that they were saying is if you do not allow them to vaccinate those children, they will close down the school. Why are you vaccinating them? But I think the best thing is for them to educate them from school to school. Let them know, be aware of it. Let them know what it is all about. Even some of them will even, by the grace of God, they will use their hand to say, okay, I want it. But when you didn't educate somebody on something, how do you expect me? And again, I said no as the head teacher. You say you will close the school down because you didn't allow us to vaccinate the children. So let them educate them first. That's all I want to contribute. Thank you.
Thank you very much, sister. That is very correct. That is very correct. Most people are not aware of this, the importance of this. And it is the health sector who's supposed to go around and educate schools, educate churches. With some parts of Kenya, they do that. Maybe some counties don't. But our counties, we go around educating schools, educating churches, even communities. We go around educating them. I don't know, Dr. Ali, you have something to say about that?
Yes, in Nigeria too, we can't really speak for all, but the way vaccines are introduced, even before the introduction, they are actually supposed to go around and educate the whole population. And if you look, it was actually on radios and on some TV stations. And then there are some people in charge of that awareness. It's a group of people in particular, because they had to divide it into stages. First, they have to raise awareness and talk about it. And then before they eventually start the vaccination. And like January of every year is Cervical Cancer Awareness Month. And then apart from that, we have other months, I think within February or March too, that is gynecological cancer. And then October is breast cancer month. So most of the time when people are talking, since it affects women, they will always talk about the breast and cervical cancer. So there are a lot of awareness, but still, maybe it's not enough to go around. It's just the same thing we are mentioning now. Before, the vaccine was not available. Now is there, people are not taking it because they don't know. And I told you, even from the small interaction I had with the religious leaders, a lot of them said, of course, why will they tell their people if they don't understand it? And that's why we are trying to organize this training and workshop to sit down together to discuss it so that people will understand, so that whatever it is they don't understand, they can even say, okay, no, what of this, what of that? Okay, this is the word to say to people so that people will not take it somehow. So you have to sit down, co-create, and then bring out those words that people can understand. So I really agree with sister. Of course, if you don't understand with all these myths, with all the news, because I remember even when it was brought in Nigeria, that's why I mentioned media. We need relevant messages from the media, because media can misinform a lot of people. Because at that point in time, people started bringing out other videos to mention things that were not even related to the vaccines. Things that happened with other conditions separately. Then they are bringing it to show videos that, oh, it's because the girls were given HPV vaccines. That's why they were behaving somehow. But later it was clear that it was all related to HPV vaccination. So I agree. There are a lot of myths, and then we have to continue to raise awareness and sensitize and allow people to understand it before they can accept. You can't just force it on people.
Thank you very much, Dr. Ali. Thank you so much, Sister Eugenia. Now you have us to ask. Even after this program, you have Dr. Ali and you have me now to find out what you want to know about the vaccine so that you can be sure of what your children are being injected. Thank you. Any other question, please?
Ulu Abdullahi Adedoku.
Yes, good afternoon, everyone, and thank you for this awareness. And I think in the course of awareness creation, you also need to include the health workers, those with low level of health education, because they also do some sort of discouragement within the small communities where these small kids of 9 years and above are to be vaccinated, because we have a similar experience when they came to one of our schools for the vaccination. They were denied. The children were not allowed to be vaccinated. In fact, some parents even wrote to the school authority that their children should not be allowed to be given that, to the extent that the school has to write to parents to say, okay, on so that this kind of vaccination is going to be given to your children. So if you agree, you give your agreement, then the child will be vaccinated. So I think really vigorous awareness is the key, now, especially in our local communities.
Very true. Very true. Very true, Kulu. Thank you so much for that. Very true. Awareness. Awareness. That is very true. Dr. Ali, you want to say something about that?
No, thank you very much. I don't know whether Kulu is from Nigeria, because I also joined part of the supervision when WHO was doing supervision for immunization, and I saw it from schools. Actually, they are supposed to write, even prior to the sensitization or vaccination, they had to write to the schools. And then after writing to the schools have to communicate to parents. And then eventually, it's all because of these myths that are coming, that are associated with the HPV vaccines, because people are not clear, they don't have relevant and enough information, so people don't agree. And that's what we are trying to do, at least to explain and then give people the opportunity to ask questions. Once people understand.
Doc, we are not hearing you anymore, or is it me?
Right, and because it's a cancer that affects the woman may be in your house, you won't know why she's with the same woman in a room, because by the time, but it's not something that everybody will just say cervical cancer. I have cervical cancer, but I know a lot of people will see, and they will have people around them that have had it, and it's not a good thing to have. Thank you.
Thank you. Yes, there are some questions in the
Somebody sound is still up.
Okay.
I'm Adedoku Emmanuel. I would still like to talk about the awareness, creating of awareness, because if not from this platform,
hey, you're breaking.
I'm very, very sure. Since you say you are from the...
Hello?
Are you getting
me? Now we can get
you. Go ahead.
Getting me right?
Okay, go on. Hello?
Okay, maybe let the next person come. Let's come up.
Hello?
Thank you very much.
Yes, Adedoku is back.
I say create and touch the house, because I know I'm create a jingle. There are some platform radio that I'm 70% of some platform. So maybe if you create a jingle and then you forward it for them to advertise, maybe to help a lot.
Okay.
Thank you very much. That's what I'm just saying.
Thank you. Thank you very much. Dr. Ali, you've got that?
Yes, thank you very much,
Thank
sir.
you.
We'll try and
Thank
work
you,
on
sir.
that.
Okay.
Dr. Sumaye.
Yes.
Yes, thank you very much, Dr. MARYAM, for that wonderful presentation and the moderator for adding value to the whole conversation. In fact, when the conversation started, I was wondering how to link it up with our community mental health. But as we progress, I saw the very, very important link. And the issue of collaboration is very critical because the ages for the vaccination fall within school age, most especially primary, secondary. I would want to suggest that there are platforms of associations of proprietors of private schools, heads of private schools, of government. That kind of platform can be used to reach out to the leaders of such associations. And through them, an arrangement can be made specifically for the experts to come and create the awareness that is needed. Then the school can now move and inform the PTA. Through the PTA, we'll have a better understanding because they are the parents, the custodian of the children. So with this collaboration between the school owners, the Parent Teachers Association, the professionals, I think it will be a very good collaboration that will yield a very positive result, because there's a lot of misinterpretation on this issue of preventive immunization. All other immunizations are being emphasized, even for us in Form 1. We talk about cervical cancer awareness, screening, but we are silent about the vaccination. But we populate all other vaccinations because there's limited understanding and there's lack of acceptability by the recipient of the vaccination. So this collaboration has to be strengthened beyond just individual schools, through the coalition of schools, heads of schools. I think it will go a long way. It's a very wonderful presentation, and thank you very much for that. We appreciate the opportunity. Thank you.
Thank you very much, Maya. Thank you. Thank you for that. Dr. Ali, do you have anything to add?
Yes, I'm noting all the suggestions. Thank you very much. I think this is a wonderful platform since we have, so I'm sure we'll have more collaboration, just as the topic suggested is a topic on collaboration. And from the questions you are seeing, the collaborations are beginning to come out. Thank you so much.
Thank you. Thank you. Any other persons? Any other question? We have some questions in the chat box. Let me see. Or some contribution. Okay. Those in charge of the program are not why are they not taking it to the grassroots? Okay, that's what we have talked about. We need to take it to the grassroots. That is where the collaboration is coming from. Some of you have suggested some platform to bring up so that at least this can go to the grassroots. Another one is, can the doctors plead with the supervisor of this program to take this vaccination issue to the rural areas? Maybe you can look at that and then collaborate with Dr. MARYAM so that we can see what we can do to make it reach grassroots over there. And here I can see what I can do to make it reach grassroots over here. They also say, I think the heads of schools have a role to play by educating the students every morning on the assembly. Of course, that is true. As you said, those of us who are here now, who are educationists in this group, who are head teachers in this group, now at least we are enlightening. And now if there's more things you want to know about this cervical cancer and the vaccine, you can always ask us, and then we can always enlighten you more, so that at least this is a very good idea that we keep telling our children on the assembly, and so that the teachers also may know. We can even have a seminar, a 2-hour workshop with teachers in schools for them to be able to understand and come to have trust in this vaccine. That's a very good suggestion. They say it is not only private school, also government school refuse to take it. That's very funny. The government who are advocating and they are refusing. It's just a matter of awareness. awareness and proper, not just awareness, just proper awareness that people understand what this is all about. That is what we need. I agree with all of you who are talking about awareness. So that is what we have in the chat box. Any other contribution, addition to this before we call it a day? Okay.
Yeah.
Alima has dropped her number. Is Alima a head teacher or in the health sector? Alima has dropped a number. I will also drop mine for those who would like to contact me.
Yes, I agree with Mr. Samuel. He's talking about that the main challenge came from parents. And even if teachers and students are convinced, we won't still have access to the students. Yes, we also agree. But you see, we are trying to discuss this from all the sectors. We need all the collaboration, because even if the head teachers too don't understand, first now, if we come to schools to vaccinate and then the teachers don't even have any information, they won't even allow you access to. And you know, the teachers at least have access to the parents. And it was mentioned that at least they have the PTA sessions and everything. So by the time the teachers themselves understand and see the need, they will give you access to have that interaction with the parents, and then everybody will eventually understand. And you know, part of the main issue is because it's given that 9 to 14 years, the other vaccinations are given before 1 year, 2 years. The baby is with the mother, is the mother that will take the baby to school. But of course, anything you are doing for a person less than 18 years, you need that consent and assent, because anybody that is not up to 18 years cannot give consent. So you need that backup from the parents, and then you need the assent. So you need those things. So they need to understand, both the parents, the teachers, religious leaders. You have to hit it from different angles. So I think talking to the teachers too will not be totally wrong, because they also have avenues where they can link you up with the parents, and eventually you can discuss with the parents, and if they know it, they understand it better, they will also give more information about it. Thank you.
Thank you. Thank you very much. Thank you. Thank you. That's Dr. Ali, please, if you don't mind, if you can also drop your number for
I will do that.
Our teachers and our medical personnel in the house. They may need some clarification before now they can start their own awareness. We are 36 here. 36 of us can actually make this go very far, like wildfire. We can make it go very far. We now know what it is. We've got something. We have been enlightened. We can now be an ambassador of this, spreading the news about cervical cancer, and knowing that you've got our backs. We will help you. Thank you. Any other person with question or an addition, support statement?
So somebody is saying in Benin City, there is no hospital you can get the vaccine free.
That's
I'm
funny.
Surprised, Madam Regina. Because you know, for now in Nigeria, all the primary health centers, you'll be surprised you don't know they are not talking about it. It's in the primary health care centers or PHCs. That is where the vaccines were taken to, because I had to go around our own PHCs here in Jos, Plateau State, to be sure. I was surprised when I went up there and asked them, okay, do you have HPV vaccines? They showed me. See, it is there, and they have access. I went to the cold chain in the state, and it's there in bulk. So what they do is that within the primary health centers, they'll give you a certain number of the vaccines, and when you've exhausted that, you are supposed to go to the state cold chain and then get it. It's the same way they go to collect all the other vaccines, hepatitis, BCG, all the other measles and yellow fever. So whenever they go to collect it in that cold room, the HPV vaccines is also there. So it's in the primary health care center. Because I know Jos is even in the second round of, what do they call it, of given the vaccines. When they started with some particular states in Nigeria, then eventually the second time all the other states. So now presently all the states in Nigeria are supposed to have. So I suggest you go to your primary health care center and ask them. And even if they don't have it, it means they didn't go to collect it. It's not because they are not supposed to have it. All PHCs have it, and it's free, because 9 to 14 years is like the primary target. During my presentation, I showed you pictures. It's not as if it doesn't affect me. It's not as if it doesn't cause other cancers apart from cervical cancers. But the number of people that are affected with cervical cancer are outnumbered all the other cancers. So that's why they are concentrating on that cervical cancer. And it's shown that, okay, if you are able to vaccinate almost like 80 to 90% of the population, you have something like herd immunity, where everybody will have that particular coverage. So that's why they are emphasizing on that mass vaccination. So the person from Benin, please go and check and ask them, even if it is not there, is it that it's not supposed to be there, or is it because they have not collected it? Thank you.
Thank you. Thank you very much. Thank you, Dr. Ali. Thank you. Any other contribution? So if there is no any other contribution, Dr. Ali, you want to give us a parting shot, closing remarks, before we hand over to Prof.
Yes, I want to really appreciate all the people in this on this platform. Especially, it was Dr. Sumaya Hamza that invited me, and then Father Cornelius kept sending us messages. We didn't want to answer, but eventually we are happy. We got this platform and opportunity to interact and see what is on our mind. And I think it's very important, and I'm happy with this. So I really appreciate the invitation. Thank you so much. So we'll look forward to more collaboration. Thank you.
Thank you. Thank you very much. Thank you very much. Thank you very much for this awesome topic. It's a topic we cannot finish discussing. Even 1 week, we can't finish discussing this topic. From my side, before I hand over to Prof, I want to say thank you very much, Dr. Ali. Thank you very much for those who got you and brought you to this group. You have approached this topic in a very unique way, and I'm very happy. This is my passion, cervical cancer. And also, thank you for all of you. 36. I'm so surprised today. I've been seeing this movie. I'm seeing 16, 9, 5. 36 is a great number. Thank you so much for all of you who have turned out today. Men and women, our brothers and sisters. What I want to say that let us be ambassadors of this collaboration of mental health. It's not only about cervical cancer. It can even pneumonia, even malaria can cause great mental health issue to the person who is suffering from it, and which can affect the whole family and even up to the community. So let's be ambassadors of this mental health series. Let's go out and tell people more. Don't suffer alone. We've got people who can help you. We can help you. If I cannot help you, I have people who can help you. And please, let us spread the news of HPV vaccine. Thank you so much, and God bless you.
Thank you very much. I think this was a very good match. Dr. MARYAM Ali and
God's name together.
and Sister Dr. LUCIANA AGBA. In fact, to have two medical doctors dealing with us today, that's why we have extended the time. Honestly, when Dr. MARYAM Ali started this topic, my mind was like Dr. Sumaya has said, where are we going? Are we going to talk about cervical cancer, vaccine? At the end of the day, you discover that it was a very unique approach. And like he said, cancer can be to MARYAM Ali apart from the injections you are given. I also thank the moderator, Sister Dr. LUCIANA ILUGBEHA AGBA. So remember that what we are still doing is the cascading of the lecture that was given to our youth, the NIREC youth, by Dr. Zila Diabo from the African Council of Religious Leaders in Nairobi, Kenya. Coincidentally, she has joined us, and she may not have to round up with closing prayer. At the beginning, a Muslim prayed for us. Go ahead.
In the name of the Father, and of the Son, and the Holy Spirit. Amen. Father, we thank you and we bless you. We thank you for this day. We thank you for the gift of NIREC. We thank you for this topic of today that has been handled in a very awesome way. We thank you for the gift of the presenter, Dr. Ali, and for those who introduced her to this group. We thank you for all of us who have listened and participated actively in today's topic. Lord, give us the grace, give us the cooperation, give us the resources, give us the mind, give us the skills, give us the wisdom and the knowledge we need to be able to collaborate when it comes to mental health. Help us to approach it from a good point of view, knowing that you are the greatest doctor. You are the greatest collaborator. Help us to be able to know how to go about the issues that have been discussed here today concerning cervical cancer. Bless the work of the hands of Dr. Ali as she goes about enlightening and educating more people and looking for resources to help those who are already in it. Bless NIREC, bless Professor Cornelius and his team. Bless all those who are in this house and their team. Lord, may you keep us till we meet again in another discussion through Christ our Lord. Amen. In the name of the Father, and of the Son, and the Holy Spirit.
Thank you very
Amen.
much from the Holy Spirit. Amen. Thank you, Dr. Luciana.